Hi, everybody.
Hello.
Let's wait for people to trickle in. Hi.
How are you doing today?
I'm doing good. I'm waiting to, oh, here we go. Cindy, hello. Okay, so we're live.
Okay, good.
Hello from Atlanta. All right, Carrie, how you doing?
And DC and Orlando.
Woohoo.
Wow.
Amazing.
Okay, yeah, where are you guys from? Austin, Texas, New Jersey. Namaste, Patricia. Cincinnati.
Toronto, yes.
And UK, wow.
All right, amazing.
So yeah, we're here.
We're here and
we've been here before.
But for those of you who don't know, this is Dr. Dennis Gross. He has seen over 100,000 patients, and he is a world-renowned dermatologist practicing in New York City. And today we are going to do a deep dive into how to treat acneic skin and also how to identify what type of acne you have.
Right.
We're going to show you some educational slides that really give you a clear indication of picking out what type of breakouts you might be having. So
Exactly.
we are excited to just get right.
So the bottom line is, the more you know about your condition, I can't believe, I'll be honest with you, how much there is for people to learn who actually suffer from large pores and acne. I mean, the truth is that, you know, it's really, there's a little bit of science and biology that if you just understood, it can make a huge difference, a world of difference to the way your skin looks. And I know that this is something that people are obviously, here you are watching this because you really want to look better. So we're going to teach you some stuff, and then we're going to show you some products, and then we're going to explain how they work. And then we're going to have you understand what additional things, because everyone's got some basic things in common, and then there's some things that make them unique. So let's start.
And the other thing that I want to let you guys know today, the code is 59acne20. So everyone can get 20% off of everything that they order for 24 hours. So you can go ahead and use that code 59acne20.
Okay.
So Dennis, one of the things that you always talk about is that every breakout starts with a blocked pore.
Exactly.
So I want to actually go right into the slides. Let me pull up the slides that you've prepared. You guys, if you're really suffering from acne, again, please take a, get out a pen, paper, and take notes, because you're going to really learn a lot from what he's going to go through right now. Let me see. They are converting the file.
Okay. So here's the thing. So the bottom line is, look, these are photographs that I actually use to teach medical students and doctors who are not skin specialists, who are not dermatologists. The thing you need to know is that all forms of acne start with a blocked pore. I cannot emphasize that enough, okay? And so the pimple you see today actually started 2 weeks ago. That's really important to know. So if you're just someone who spots treats your acne, you're missing the big picture. You need to work on your skin everywhere you're prone to break out and prevent it in the first place. That's the goal, and that's what we're going to show you how to do, okay? Is there something else you want to show, Renee?
So I'm going to go to the next slide. So those are the different types of acne.
Right. So basically this is, and now look, everyone knows that top photo, okay? That's a blocked pore. And you may have a lot of those. You may have just that is your only condition. Or you have to understand that is the enemy, ladies and gentlemen. That is what leads to every form of acne and worsening acne. It all starts with that blocked pore, okay? Because what happens after you block your pores, and I'm going to teach you what it is, why it's happening. Next slide. Okay. It gets worse.
And Dennis, really quick on this slide, someone's asking, how can you tell the difference between that acne and a rosacea bump?
Okay, so like, Renee, I'm all over it. Just go to the next one. Let's take a look. You can't right now, but here's the next slide, okay? After you get a blocked pore, bacteria gets trapped. And you may have a little bit of these guys, you may have a lot of them, but it went from that blockage to this. Because behind that blockage, what happens? You're trapping bacteria. Bacteria gets trapped, and then you get inflammatory acne. It gets red. It gets inflamed. It gets infected, okay? The next thing you got to do is go to understand what we just talked about, that blocked pore. If you have T-zone acne, it's still a blocked pore, right? It just happens to be blocking in your T-zone. Next slide. How about jawline acne? This is hormonal acne. This is what happens to women, right? At a certain time of the month, you might start to get it. This stuff, though, even if you're just getting premenstrual flares before your period, it started 2 weeks before that. How? With a blocked pore. Next slide. Let's look at some other stuff. So this is more of a picture that sometimes it runs in families, and it gets bigger and deeper, and then sometimes you get actual cysts, and they hurt, okay? So this is just what happens with the next step. But it all began with that blocked pore, then the bacteria, then the redness. And I want to go right to the looking at the most severe. Again, these photos are not, they're not meant for the people like you guys, to be honest, but so these are teaching slides in the medical community. So the more severe slide, if you look at grade 4, scarring, right? But the scarring is fixable. There's certain things you got to do, but it's different, okay? So it all began, look at this, so go 1, 2, 3, 4 across those things, right? Blocked pore led to the infection, led to number 3, more severe, led to number 4, most severe with scarring, okay?
Okay, so Dennis, can you talk a little bit about, like, so I can see the scarring on, grade 4, but can you really explain scarring?
Can we get off? Okay, can we take the slides off?
Yeah, hang on.
Okay. So there it is in full detail, okay? So so that's what a scar looks like. Sometimes you're left with just the scars, and sometimes you have scars with breakouts, okay? So Renee's asking the question, what led to scars, right? Here's a myth. There's actually 2 different types of scars. There's the scars you just saw, and that's because the skin looks indented. Why? Because it's the infection was so bad it killed normal skin, and even after the acne's gone, that collagen that gives you that structure and firmness died. That's all it is. And then your skin caves in. The second type of scarring are brown discolorations, right? They're very different. Why is it important for you to know that? Because the treatment is day and night, completely different, because they're 2 different problems. Collagen, pigmentation, okay? That's all I want you to know for now.
And then Sonia wants to know, can hair on your face block a pore?
Yes, absolutely. Because men, lots of times when they shave, get ingrown hairs. Lots of those men get breakouts. And ingrown hairs, like you can actually get acne in your groin. You can get it under your arm, where the places where you have hair. And even on our hairs, even our face here, we have little peach fuzz hair follicles. You may not even see them. Can happen there too.
Okay. So the first thing that I want to talk about going right into this is how important steaming can be for.
Right. Okay. I want to talk about cleansers too at some point.
Yeah, I'm going to talk about, I'm just going to steam a little bit first, and then I'm going to cleanse my face.
Okay.
But can we talk about how steaming is a gentle way to.
Great way. So here's the thing. I love, in my practice in New York City, so everybody with breakouts, large pores, acne, they come in, lots of them get facials. And facials really work because that steam, as long as it's not too harsh, too hot, is going to melt away the blockages, okay? And that's a great way to decongest your pores, and that helps get rid of all the breakouts you get from them. It also starts to clear up your skin. So it's natural. Think about it. Steam is warm water, but it's also delivered. Look at the pressure, okay? You can put your face, there you go. But people with breakouts and large pores love to do that. They love to put their face right into the steamer. And it's important to do that. So that this device is actually designed so that you can go close, really decongest your pores, really clean them out, get that makeup out of there, get that debris that causes the blockage, clean it out, stand further away so you get this nice overall glow and decongestion everywhere. You don't know where your next pimple's starting, right?
Okay, so
2 weeks ago.
People want to know how often they should steam. And Scott, what's the ideal time length to steam for? This steam actually goes for exactly 9 minutes, and 9 minutes is what you need for a professional ionized clean steam. I personally don't think that you can ever over steam. For me, I try to steam at least 2 to 3 times a week, but Dennis, I don't think you can ever over steam, right?
That's the truth. Some people who love to steam every single day. I got to tell you something. I think you should steam every day. If you're really broken out and you invest in this, it's designed to be used as often as every day. It's 9 minutes. It's not too hot. It's not going to cause redness. It's super warm, but it's calibrated. That's the thing. My team and I knew we had to come up with a device that had the right temperature and the right pressure, and it's only 9 minutes. So you can do it every single day if you have the time.
Okay, so I want to go into how important cleansing your face is. I let the steam actually break up my makeup a little bit, and now I'm going to cleanse while I'm steaming. But we have 2 different cleansers. Okay, so we have the all-in-one cleanser with toner, which is a creamy cleanser. And then we also have the alpha beta pore perfecting cleanser, which is more of a foaming cleanser. So can you talk about like how you would choose each one?
Sure. So the bottom line is, as long as these are both products that are going to work on your pores, okay? If you have sensitive skin or you have dry skin, we have a creamy cleanser. If you like that one, go for it. There's no right or wrong. If you have oily skin, and some acne people don't, let's face it. And then if you have lots of breakouts and large pores, the foam cleanser, it's called the alpha beta pore perfecting cleanser. Okay. That is the one that if you have a choice and you have acne, go for that one. Okay. Because that has ingredients that actually kills the bacteria. It has ingredients that actually takes away that blockage. It is a really powerful but gentle acne product for cleansing. You want to take your makeup off, they both work. Okay. So select.
Okay. So can you also talk about like what if your skin is drying out from like being on oral acne medication? Which one would you choose?
Well, you know what? If you're super dry and it's uncomfortable and you see any trace of red, go with the creamy cleanser, okay? Everybody else, just go with the pore perfecting cleanser, okay? Each of them, they both have toners and astringents built in, okay? That creamy cleanser is strong, don't get me wrong. It really does 3 things. They both do. Cleanses deeply, decongest pores, takes off your makeup, and it's got a built-in toner, okay? I don't love toners as a separate step. I don't love harsh scrubs. They both have issues, okay? And so steaming is really helpful. The cleanser is really great, okay? But one of the most important things I want you to know, as a dermatologist, you should know, you want to never overstrip your skin. You never want to throw your skin off balance. You don't want to make it red. Why? Because then all the ingredients, all the products that you use afterwards, if your skin's in balance, your skin's going to accept it. It's going to follow instructions and clear you up, okay? If you start off really red and uncomfortable, it's going to be hard to use those products. That's why you got to not overstrip.
Okay. So Jennifer is actually asking a question that we're going to go right into now. And she's wondering about how you use steamer than the LED mask. So you want to steam, cleanse, and use LED on clean, dry skin. And LED is one of the best things you can do for acne for a couple reasons. You've got the blue light, which is going to kill active acne bacteria, but also the red light's going to help with inflammation and also rebuilding that collagen from the scarring, the depletion of collagen. So can you talk a little bit about the different types of light, Dennis?
So what you just said, Renee, is spot on. That is so important. LED is just like the steamer, is a professional treatment that we do in dermatology for acne patients. This is an at-home medical device, FDA cleared. The red light is going to work on redness. It's going to work on building back the collagen that caused those indented scars, okay? And then it has a blue light, not just one, but both. The blue light kills the acne bacteria. That's crazy, okay? And it's so important. And so if you have redness and pimples and blackheads, and you have some scarring, hit the button twice and do both red and blue, okay? I think you should, because it's unlikely that somebody has no redness at all from their acne. If you don't need it, you can just go with the blue light. But the truth is that the red and the blue don't lose strength when you use that third setting. They both are participating equally and as strong as they did alone. That's the key.
Okay, so we've got a bunch of questions
Good.
regarding Dennis. So people want to know if LED will bring acne to the surface.
No, acne is going to kill it. Now, sometimes your acne wants to come to the surface, okay? So that's a very good question. And sometimes that has to happen. If it starts to happen, here's the thing. Treat through it. Kill it. Go at it. Don't stop. It's fighting you a little bit. You're going to win the battle, okay? And then if you continue to use it, you'll prevent it, okay? The best treatment for acne is to prevent in the first place.
Okay, and then Kara's asking about different LED masks that she's seen with like 7 settings with all different colors. So can you explain?
There's only 2 bona fide LED treatments, right? 2 colors, red and blue. That's it. Listen, how do I know that? Because the professional unit I use in my office as a dermatologist is only red and blue, okay? That's the only one. The other thing is sometimes if you want to play and push, and so you go from 1 to 7 and maybe it's maximum at 7, this is maximum from the get-go. I didn't see the reason to play around with lower levels. There's no downtime. It doesn't hurt. And it's safe for the eyes. It's something that you just got to use every day. I'm telling you.
For 10 weeks, yep.
Really.
And that's the thing, you guys, this is an actual medical device. So Danielle, you're asking about using the LED mask morning and night. No, once a day is enough. You want to stimulate the collagen, kill the acne every 24 hours. You want to commit to this for a full 10-week treatment.
And it's 3 minutes a day, though. That's it. And you'll see results in 2 weeks. That we know that to be really, really important, that you don't want to wait for 10 weeks. But you got to stay on it. The effects add up, okay? That's really important to understand. That's a major principle in treatment. The results are called cumulative, right? Day in, day out, you're getting better and better.
So I also turn it upside down and I do another treatment, another 3-minute treatment on my neck because I am someone who gets hormonal breakouts under the chin. And also this helps build the collagen. But SD, you said, are the LED treatments good for darker skinned individuals? That's a really good question because a lot of times if you have darker skin, you can't do lasers. You can't, this is safe for you and this is great for you. Right, Dennis, would you say?
It is. And you know what I love about it for that type of skin, let me tell you, lots of times acne and darker complected skin, if there's any redness in that type of skin, it turns brown. You know what I'm talking about. Red turns to brown in people who are anything else but super pale, okay? And so the red light, which brings down the redness, is preventing the brown. That's a really important, again, we're getting good stuff here. These are principles that if you understand, I think you can really look better.
Yeah, because people are asking about pigmentation with this mask too. This mask does help pigmentation.
It prevents the redness that leads to it. Now, here's the thing. We're going to show you another product specifically for pigmentation, okay? When I treat pigmentation in my office, it's with something called the IPL laser. We have a product that we named after it. It's the Ipl Serum.
Okay, so Elizabeth also wants to know, can you explain white bumps that won't go away? Elizabeth, you might be talking about milia. The way that your description sounds like, it sounds a little to me like you might be discussing milia, which also can come from products that are too heavy in oil content that your skin can't, digest that oil. So, chemical exfoliation with acids can really help that, right, Dennis?
And the alpha beta peel is a specialist in that, okay? We know all about it. And one more thing. When we talk about moisturizers, because lots of people with acne need moisturizers, that's the major reason you'd use an oil-free moisturizer, which is the ones we're going to talk about later, okay? It has to be oil-free because if your skin is already getting clogged, using products with oil in it will clog it up even more. So you got to know about oil-free moisturizer as a special type of moisturizer for acne skin. We're going to talk about that in a few minutes.
Okay, so actually, since we're talking about the alpha beta, I want to go right into that because after you cleanse, steam, and LED, you're going to want to use an alpha beta peel. And this is what Dennis is famously known for. Okay, these are our 2-step alpha beta peels, which use acids to gently exfoliate the dead skin, right? Which you build up every 24 hours. You build a layer of those dead skin cells. So this is going to gently remove that while helping with pores, breakouts, pigmentation, fine lines, wrinkles, pretty much everything.
Yeah.
And
it comes in 3 different types. Okay.
Yep.
And so here's how you choose based on your skin type. Okay. If you have sensitive skin, your skin's on the dry side, this is the ultra gentle, the one with the baby blue strip. Okay. If you're pregnant, this is the only one I want you to use. Okay. But this is gentle. It gets the job done, but it will keep your skin in balance and it's not harsh. This is the one, the orange. Okay. It's universal. It's basically the one that says, my skin might be a little combo, but I'm not too dry. I'm not oily. And I have acne and I want something. That's your intermediate. And if you want to really go for it, extra strength, the red one. Okay. So this is one for people with oily skin, with really severe breakouts, who really want to tackle it. Even if you have a little bit of a nuisance acne and your skin is not sensitive, extra strength. That pore perfecting cleanser and the extra strength peel together, that's the most powerful combo.
And then a couple questions, Brenda and Alvin, talking about those acne scars, those indentations. That's what Dennis was speaking about with stimulating the collagen from the LED. So red light actually stimulates your natural collagen to build that back up.
It's fibers. You lost the structural fibers, the cables that keep your skin firm. Boom, they were destroyed. We can get that back. You cannot. Remember, I use the word collagen as a structural fibers. You can't drink collagen and get it back. Believe me, that's a myth. Okay. All you can do is use ingredients that stimulates your skin's own ability to make more of its own collagen. That's the only way it works. Believe me. We're going to talk, and the LED light does that. We're going to talk about another product, a serum called vitamin C serum. Okay. We'll talk about that for scars too in a minute.
Okay. So a couple things, you guys, when you get these packets, you want to take out step 1 first, and you're going to swipe it all over your face. Now, I know a couple people are asking, can you start with the extra strength? Absolutely. I'm using the extra strength now. And I know people are saying, oh, what if I get a little red? That's normal. Okay. That's normal to have a little bit of pink after you peel. It's going to go down after the second step anyway, but you want to apply the first step all over your face, all over your neck, your chest, the back of your hands. Okay. And then you're going to wait 2 minutes before you apply it, step 2.
And what that first step is doing is it's getting into your pores. It's decongesting your pores. Here's the problem. Why is the first step of all acne a blocked pore? Because everybody with acne has a little problem with their oil chemistry. Your people, if you have acne or a complexion problem, the oils the skin makes are too heavy for its own good. Instead of flowing like a liquid through the pore, it actually is a little too heavy and it gets stuck in there. The alpha beta peel with the first step, that blend of gentle acids, get into the pore, melt them away, dissolve them, and it also starts to make your oil chemistry more normal, so you stop making this abnormal oil. Okay? So that's what's so important about the first step. Redness, don't worry about it, because the key thing is it's a 2-step peel. That's what makes it super special, okay? Dermatology, like we talked about, the LED in dermatologist's office, steam in dermatology office, peels in dermatology office is done all the time. It's always 2 steps. That's the professional way to do it. That's why it's gentle on your skin. The second step stops the acids. It doesn't make you red because the acids are turned off because of that key second step.
Yep. And so the second step, you want to wait for 2 minutes. So I always just brush my teeth. And by the time I'm done brushing my teeth, it's time for step 2. I actually just did a poll, Dennis, to see if people can understand like really how a breakout starts.
Yeah.
Whether it's from a clogged pore, sleeping with your makeup on, both of the above. Well, sleeping with your makeup on can lead to a blocked pore for sure.
Oh my God. Absolutely. It's terrible for you. Okay. You got to wash your face twice a day.
Yeah. Okay. So now I'm going to do the second step. A couple questions. Sonia, what's the difference between this and a glycolic peel? There is glycolic acid in here. Okay. Right. So you're getting that too. The whole point is that he uses multiple acids to target a bunch of different problems at low doses so that he never disrupts the balance of the skin.
Correct.
And then I'm going to do step 2. And yes, you can use the peels with retinol, and which we'll talk about that in a little bit, but I'm going to do step 2. Can you talk about some of the ingredients in step 2?
So step 2 is what makes this a true peel. There's no such thing as a one-step peel. If you have a product that's a one-step peel, it's just strong acids all by itself, and it's a powerful exfoliator. Peels are 2 steps. The second step we talked about. It stops the acid to keep them safe after they do their job to work on the pores. Then it has ingredients to soothe the skin. And then it has ingredients to make your skin healthy, right? Acne means your skin is unhealthy. These are ingredients, there are vitamins in there, there are nutrients in there, there are antioxidants in there. There are ingredients that will help your skin look better in general. It gives you a beautiful radiance, and it works on your pores, and it works on acne, and it can help your scars.
Okay, so speaking of pores, I want to talk about the clarifying mask, which I'm going to apply now. Just so you guys know, this is a mask that I usually do once a week for, I usually leave it on for like 10 to 20 minutes, but you can also use this as a spot treatment for breakouts. Like if I have a big breakout, I'll use this mask and I'll sleep in it. You can also actually use this as a makeup primer. It blends into your skin, a really thin layer, and it controls the oil all day. So can you talk about sulfur and how this can help?
Right, sulfur, not to be confused with sulfa, which is a medication. Lots of people have allergies. Sulfur is an element. It's natural. It's found in nature, okay? And it works by drawing out the oil that's trapped inside that pore. So it's great to use as a spot treatment in an area where you have breakouts, or use it every single day as a mask if you want to. And especially if you have oily skin, it's a great idea, okay? It's powerful to get rid of that blocked oil gland as well.
Okay, so again, okay, people are asking, can I wear the clarifying overnight? What product can you put over this? So if you're gonna use the clarifying mask overnight, what I tell people to do is put all your products on first. So your serum, moisturizer, and then you would put on the clarifying as a spot treatment as the last step.
Right. But you want to treat all over, okay? Don't think about spot treatments. Remember, you don't know where the pimple you see today started 2 weeks ago, and you don't know where the next one's coming from, and it's a problem with the flowing of your oils. It's not flowing. You got to treat everywhere all the time to prevent the blockage in the first place. And so the products are designed to clear you up and then to stop the very problem that's the source of all acne, that clogged pore.
Okay, so people want to know, what are your thoughts on pore strips, Dennis?
Pore strips are nice. They're nice. You know, they help if you like them, you use them. But you want to prevent the pores from forming in the first place. But you also can only use them here, right? Most people with breakouts have them all over their face. So you need other measures, but if you like it, great.
Okay, and then people want to know, is it normal for you to sometimes start purging, which means, you know, once you start peeling and using pore serum, can you experience more breakouts?
Briefly, possibly, okay? But you gotta ride that out. You have to understand that's the road to clearing your skin, because don't think that clogged pore stops there. It's going way deeper than that. And so if you have blockage in your pore, you have it in that whole pipeline. It's got to come out. And the products are designed to make sure you got all of it out. Lots of times people with breakouts have that stuff. Start and don't stop. It will end, and then you will really see, okay? It's not crazy worsening. It's not like you get dramatic difference in doubling your breakouts, but you would start to think, well, wait a second. I should be getting better. I'm seeing more. Treat through it.
Okay, so 2 questions before we actually go into the next product that I want to talk about. People are saying, are people with larger pores prone to cystic acne?
They can be. The more important way to look at it is this. Cystic acne began with that large and clogged pore, right? All forms of acne start with that blocked pore. And it doesn't matter where it is, in the T-zone distribution, in the hormonal distribution, all over, which is the kind you see when it runs in families very often. The problem is that blockage, okay? So we're always tackling that, and we're doing it in different ways because it takes different ways to help that problem from forming again, okay? So just listen to what we're saying and then say, I like the idea of a peel, or I really need that cleanser, but don't worry, everything is targeting the specific problem, that pore.
And speaking of pores, can we talk about this product. So this is one of my absolute favorites. This is a pore perfecting serum. And the thing that I love about this is I have enlarged pores all over my nose and on the sides of my cheeks. And there's been so many like makeup primers that I've tried that are pore refining primers. And it's amazing because I put them on and you can't see the pores. But then at night when I wash my face and the primer comes off, all the pores are back. Right. So can you explain how this actually treats the pore?
Exactly. So this is a product that if you have acne, you want to use this all over. And if you have only blocked pores in certain areas, Renee has to say that, you just use it as a spot treatment. Here's the thing. What is a serum? A serum is a powerful product that has the sole purpose of targeting the particular problem. Pores, in fact, are clogged for 7 different reasons. So this is a serum that's super comprehensive. My team and I really studied it and investigated what clogs a pore. How does it go wrong? How does that flow? Why is that flow so heavy? 7 different reasons. So this is a product that gets deep into the pores, that stops the difference at all those 7 checkpoints that exist for a blocked pore. You can't just use one ingredient. One of the most important things is understand there's no one ingredient, it's the magic bullet. Years ago, benzoyl peroxide was supposed to be it, and glycolic was supposed to be it. And then things were still not good enough, so now you start seeing other products. Study that. I did. 7 reasons. This is so much more than a single ingredient, but that's what you need for the deep blockages. This is a powerful serum.
Okay, so I'm actually going to use this a little bit as a spot treatment. So if you're someone who has breakouts all over, you want to use this all over your face. But I'm actually just going to use it on my chin and around my nose because that's where I have enlarged pores. And that's also when I do break out, it comes on this entire area.
Perfect.
People want to know what are the 7 reasons.
Oh my gosh. Well, look. So I'll tell you. There's more than one, okay? One of them is that the glands have hormonal receptors. Others is that sometimes that the oil itself builds up and it gets attached, it gets stuck in it to the lining of the pore, okay? You have to have ingredients just to detach it, okay? Then you have to have other ingredients that make sure it does flow, that it doesn't get stuck along the way. That's just 3 reasons. There are more, okay? But understand it's complicated and it's a long path from that opening called the pore from the gland down here. So that pipeline is long and a lot can go wrong.
Okay, so Kim actually asked a great question, which is the next product we're going to talk about. She asked if the pore serum can be used with the IPL. Absolutely, I'm going to do that now. But the next serum we're going to talk about is IPL Dark Spot Correcting Serum. You guys, this is amazing. This is clinically proven to be as effective as 4% hydroquinone with none of the side effects. So one of the things I'm actually going to ask you guys in the poll right now is when you actually go see a dermatologist, which treatments clear hyperpigmentation? So I'm going to start that poll as well. But DG, can you talk about hydroquinone?
Sure. So here's a little test question that we talked about. This is important, okay? I hope you get this right. The second question is about what can help with hyperpigmentation.
Okay, so let's see. Oh, they all know 2 weeks. Yes, the pimple's been forming for 2 weeks. You got it, folks.
Really important point. So you got to prevent it. Don't assume that things are going well. Spot treatment, this is the boat, right? Clearing and preventing the clogged pores and everything that came after it, the bacteria, the inflammation, the redness, all of that stuff. You got to treat those things, and those ingredients are in here too, because all we know there's more than one thing that we have to treat, but we got to prevent and you got to know the target. So here's IPL serum, okay? This is for the other type of scarring. This is for the scarring where you get brown spots even after the breakouts are gone, where they once were, okay? That's pigmentation. It's called melanin. This is what is deposited in the skin. This is something you put on those spots. This is another serum, right? Another targeted, powerful treatment for a different thing. We had pores. This is a serum specifically for discoloration, okay? And here, there's 5 different ingredients that work on hyperpigmentation. That's what this is, a buildup of melanin. We got to prevent it. We got to destroy it. We got to prevent its transfer from the bottom to the top. All those things, there's 2 other reasons, but there's 5 total. There's no such thing as one ingredient that does it all. 5 different ingredients were necessary from that we did the research. My team and I, 5 of them we came up with. That's why this is a powerhouse. We named it after IPL laser, which is a laser in my office that we use to treat hyperpigmentation with.
Which was what you guys were clicking on in the poll. And then I also want to answer a couple questions because people are saying, hey, is it normal? Is it still working if the IPL serum gets darker in color? Okay. Yes, it's still active. That you don't need to worry about it turning dark. People are saying, I'm not like, is it still working? Is it still effective if the color is not clear?
Absolutely.
And it's darker?
Listen, this is a clean product. Some of you know what that means, right? We could have put ingredients in here that changes it. We decided not to. Okay. So it's a natural progression for the ingredients to darken. Don't worry. They're active. We're not going to give you something that isn't going to stay active and continue to work. This is a product that works as well as the ingredient that was prescribed called hydroquinone. That product made people red, made people really irritated. It sometimes made them even brown, discolored, even worse. Didn't love that. This is an alternative without those side effects.
Okay. And Tiffany wants to know if this is only for acne hyperpigmentation or if it works for sun-related pigmentation as well.
You bet. It works for all types of hyperpigmentation. I'm so happy. How about melasma? I saw someone ask that earlier. There's the areas where you see discoloration and patches here or on the forehead, the same thing. Hyperpigmentation, all caused by melanin. Melanin is what the 5 ingredients are tackling. Okay? All forms of discoloration.
I also want you to know your wife is in the chat being very helpful and answering a lot of people's questions.
Oh, good. Okay.
Well, thanks,
thank you. And she gave me a little apple cider before I came on. Thanks, Carrie.
Oh, that's so sweet. Okay. So next serum that I want to talk about that I'm actually going to apply all over my face is the vitamin C and collagen serum. And can you talk about how that's beneficial for scarring?
Right.
I dropped it on the floor, so I have to get it.
So this is vitamin C, right? Another serum, right? This is for indented scars, right? So everyone who has acne has to deal with the blocked pores and all those bacterial issues, but then people have some discoloration. Some people have pores elsewhere. Some people have scars because they lost the collagen fibers by the acne being so radical that it killed that tissue. Vitamin C in this product is an ingredient that helps your own skin build back your own collagen, which is the only way to do it. It restores those fibers so that the skin, instead of looking indented, you put it on those areas twice a day, maybe here, you really will see that the scars come back to normal. They look so much better because we know vitamin C, powerful delivery system for breakouts, can help you.
Okay, so I just pulled to see how many people know what vitamin C, how it can help acne scars. But the other thing I want to tell you about vitamin C, this vitamin C and collagen serum, is it also helps firm the skin. It brightens the skin, it firms the skin. And I want to talk to you guys about usage. A lot of people think that they need so much product, so much product. One pump is more than enough for your entire face. Okay, you don't need a ton of this. It's very efficacious. It's very powerful. One pump is more than enough for your whole face.
And it's super quick to dry. Okay.
Yeah.
So Renee is the chief esthetician for us. We got to tell them about how you teach people to layer, because sometimes you're going to need more than one product. If you have a combination, maybe you have pores, you need a serum for that. Maybe you have hyperpigmentation, you need IPL. How do you work it, Renee?
Okay, so you guys, just like how I put it on in this show, you always want to do thinnest to thickest. So you'll see that I put the pore serum on first because you can look at the actual viscosity of the serum and it's very liquidy, almost like a light water kind of texture. And the same with the IPL, which is what I used as spot treatments for my sun damage. But you would use the thinner serums first before you used a thicker one, which would be vitamin C.
Right. And then it makes sense that if you need a moisturizer, you know it's going to be thicker than any of the serums, different product, different concept. It goes on afterwards.
So speaking of that, let's talk about the 2 moisturizers that are great for acneic skin. So Dennis, you know, he always preaches about the oil-free moisturizers so that you're not reclogging those pores that we're trying to unblock, right? So we have 2 different types.
Right.
We've got the hyaluronic oil-free moisture, and we have the alpha beta oil-free moisture. How do you choose?
Well, here's the thing. If your skin is really needs some hydration, serious hydration, the alpha beta, that white product there, the white jar, is a little heavier, okay? It's a little bit more moisturizing. It's thicker. That's all there is to it. But it's oil-free. It's not thicker with oil ingredients that are going to clog your pores, and it's super hydrating, okay? Then there are people who like a lighter weight moisturizing gel. That's the blue product. That's Moisture Cushion. That's using hyaluronic acid to internally hydrate your skin, not necessarily putting things on top to layer it. The first one does more of that. Not crazy, not shiny, not thick, but this one really gets your hydration levels up immediately internally, so you can layer your makeup on beautifully. And if it's hot out and your skin's oily, maybe you should use the oil-free Moisture Cushion. Want a little bit more activity, more moisture? The white guy, Alpha Beta Moisturizer.
And another thing that you guys can use, if you're on acne medication and you're finding that your skin is extremely, that it's really drying out, we also have a hyaluronic serum, which is a booster. And sometimes if I'm feeling extra dry, I'll actually mix a couple drops of this in with my moisturizer and apply this. This is straight up hydration, but it's still going to be oil free. So if you're someone that's really drying out because you're either on Accutane or you're using, topical treatments that are very drying, this is something that can definitely help.
Right. So here's an example. So now what we're learning about is the first problem is a clogged pore. That's where your alpha beta peel comes in. That's your cleansers targeting it. And then you start to have more specialized problems, maybe of scarring, maybe of hyperpigmentation, maybe of regional pores. If you need targeted hydration, this is a hydration serum. So you can use it as a potent boost for your moisturizer. Moisturizing is so important if you have breakouts. You want your skin to stay in balance. If your skin's a little dry, you need to moisturize it because now it's going to stay dewy, it's going to stay hydrated, it's going to look and feel so much more healthy. We know that. Water content in your skin, we know how important it is to drink water. You got to give your skin fluids. You got to give it hydration. So moisturizer is very important too. That's a serum if you want a little bit extra.
Okay, so people want to know, what are your thoughts on benzoyl peroxide?
Hate it. Tell you the truth. I think that it's a dinosaur. I think that it's harsh. It's something that it can help in the laboratory. It does kill bacteria. But you know what? Let me tell you. You might have heard of this word free radicals. I don't know. You've heard of it. And that's why antioxidants exist. Antioxidants get rid of free radicals because free radicals are bad. Benzoyl peroxide, the word peroxide, what is that? You heard that's the brown bottle stuff that you pour on wounds and it fizzles, okay? That is part of the chemistry of benzoyl peroxide. It's free radicals, super harsh, super irritating, throws your skin off balance, does nothing for that pore. Okay, it's an antibacterial ingredient, not a decongesting, unclogging pore ingredient. Big difference. It's a little bit too harsh for the limited benefit it gives you.
Okay. Next question is, people want to know about our acne eliminating pads. I've got a couple questions about these.
Show them how big it is.
It's huge. And for me, I actually usually only recommend these on the body, but Dennis, can you?
So some people have acne on their chest. They have it on their arms. They have it on their jawline. They have it on their butt. They have it on their back knee, right? This is a huge problem that many people that come to my office ask for help, okay? This is a product that's a super powerful acne pad for body acne. This is not for your face. This is too strong for your face. But if you have breakouts, you have blocked pores, you have pimples, you have whiteheads, you have blemishes on your body, anywhere from here down, go ahead and use this product. It's once a day. Work it in until the pad is dry. It is a powerful product that treats body acne in very many different ways. It doesn't rely on one ingredient. We're not calling out just one. Many ingredients once again.
Okay, so I don't know if I'm allowed to say this, and I don't know if I'm going to get my hand slapped, but Luis is asking if new acne products are coming this summer, and there is a really amazing one coming. Am I allowed to talk about it? I don't know.
No, you're not. Now take it back.
So there is a product that Dennis has been working on.
I have. But listen.
How many years have you been working on this acne product?
I have to tell you that this is a problem that people have, and just stay tuned. These products we're showing you now have been dramatic, okay? And there's going to be more. But you got to start. You got to prevent. You got to treat those pores, kill the bacteria. Then you got to choose, which scar type am I? Indented, brown, discoloration. Do I have large pores? Do I need extra hydration? Learn about your type of acne, and it doesn't matter if it's T-zone or cystic here or hormonal, cystic everywhere. These are ingredients and treatments for the prevention and the actual targeting of all the different problems that people have when they break out.
Okay, there's so many questions. This is amazing, you guys. We love hearing your questions, and this is what we're here for. Rhea, tips on ingrown hairs on the face.
Okay.
I would say obviously our peel pads, but do you think the pore serum would help with that as well?
Exactly. It's a blocked pore. The hair follicles is an issue. It's making it worse. It's complicating matters. Nonetheless, the rule is simple. All acne starts with a blocked pore, period. All our treatments are going to help that, whether it's from the hair follicle or not.
Okay. And then what about like lifestyle changes for if you have acne? Like, do you think that, because sometimes I hear patients come in and they say, oh, I'm not supposed to eat chocolate because I heard chocolate gives you
So here's
acne.
the first thing. Okay.
Can you talk a little bit about that?
Let me tell you about what it means to be a doctor. You have to listen to your patients. And sometimes patients will teach you and tell you things that aren't necessarily known to be true. No doctors can claim to know everything. If you think there are foods you eat that cause your acne, and if you've eliminated them and it's helped you, you do that. You stay it. If you stop dairy and it helped you, great. You went gluten-free, it helped you, great. Okay. You cut out chocolate, it helped you, great. But what Renee's getting at, while she's grinning, is because the truth is that the studies show that there really is nothing in your diet that does anything to contribute to your breakouts, even greasy foods and maybe sugar. Okay. And this is when I say maybe, I'm just being honest. The medical literature, the reports, they don't have the whole entire story down pat, right? So I'm just reporting to you what we know to be true without editorializing it, right? Nothing has been shown. I want to say one thing real quick. Okay. Rosacea, it came up very early in this show. Rosacea is a very specific type of acne. It's called adult acne. It really happens more through here. It's redness, it's a bump, and you may have been given that diagnosis, okay? This is something that these products will help you dramatically, okay? Rosacea is a big problem. Every single product here helps rosacea too.
A couple things that I want to point out. Linda's saying not even fried foods can cause acne. Linda, I have to let you know. So Dr. Gross, we always joke around and he always says, I know my products are working because you're the most unhealthy human I've ever met and you still have really good skin. I am a fried food lover. Okay. I'm not proud, but I live off of fried food and I still have really good skin. And I think that that's kind of the misconception of, and I hear people say like, oh my goodness, water, my skin's dehydrated, so I need to drink more water. Look, drinking water is great for you and it's amazing for your body, but it doesn't necessarily mean you're going to look hydrated in your skin.
That's right.
Right, Dennis?
Right.
Okay.
Absolutely. And I just want to say something else. For rosacea, there are dietary measures that we know makes rosacea worse because rosacea means you have redness in your skin. Red wine, spicy foods, caffeine in excess, all three in excess, definitely will make rosacea worse. They're the science. They're the reports are very clear.
Okay. Linda said that her teenagers are happy to hear this about fried food. So you guys also, someone was asking about having a handout of the products we're using. I did actually share the handout. So if you go in the top right-hand corner, you'll see the little handout button, and that's going to give you like a detailed list of which products we have used during this whole
what's that code
seminar.
Tell them the code.
But I also want to talk about
what's the number?
Oh, yes, the code. Yes, the code is 59acne20. That will get you 20% off everything, including $100 off your LED mask, which is amazing because this is a game changer. But the other thing I want to talk about is two things, Dennis. We have to get into SPF, but before we get into sunscreen, can you talk a little bit about acne that's coming from wearing these masks from Corona?
Absolutely. This is a huge problem, and I got to tell you, this is uncharted water. But when you wear a mask, trapped under that mask, there's bacteria from your mouth. There's more humidity. There's moisture in your breath. You go like this. You can fog up your eyeglasses, right? There's moisture that's trapped. There's CO2. That's what you breathe out. That's trapped, and there's pressure from the mask. So there's a big problem with mask wearing. Let me just tell you some tips. Wash your face with lukewarm water only if you have redness or breakouts, because you don't want any temperature extreme. Too hot or too cold is going to aggravate the redness. And before you jump in the shower, having worn a mask, make sure the redness comes down. Give it some time to calm down before you get into that hot shower again, okay? And it's super important to avoid harsh ingredients. Benzoyl peroxide, hydroquinone, we got you covered. If you have breakouts, none of our products have those ingredients in there. We have alternatives that really help. I think they're even better, okay? So wearing a mask and having acne, it's challenging. And if you're going to use a moisturizer, definitely use oil-free, okay? You don't need to trap moisture and oils under your mask.
Yep. Okay, so people who are asking about the code for Canada. So this code is not set up in Canada. However, you can use the code RENEE20, and that will give you the discount in Canada. So it is RENEE20, and that code will work for if you're living in Canada, just to let you know. And the discount is good for 24 hours. Okay, so you guys have got 24 hours. I want to talk about, because we only have 8 minutes left, and I don't not talk about SPF because I think it's really important for people who are suffering from breakouts as well. So can we talk a little bit about sunscreen?
You bet. So here's what's really important. Everyone knows that sunscreen is important. I'm not here to teach you what you already know, okay? But I do want you to know that sunscreen can definitely block your pores, and the sun can definitely make those brown spots worse. That if you're someone who's getting this discoloration, whether it's in your acne marks, acne scars, or melasma elsewhere, the sun is your enemy. You gotta wear protection, okay? You also have to love your sunscreen. I know that. So we have ones with a little tinted moisture added to it, and we have ones without, but they all are not gonna block your pores, and they're all gonna use the healthy form of what's called physical blocks: zinc oxide, titanium dioxide. Just look for the word oxide. All those other chemical sunscreen ingredients have been found to enter the bloodstream. That is by the Food and Drug Administration of the US government's report several weeks ago. Way too high, and the levels they themselves are saying we have to investigate further and really see about the safety. Don't wait for the safety reports, folks. Don't take a chance. Don't put a chemical sunscreen on that gets into your blood. You don't need to take the chance. Physical blocks, don't do that. They're the only ones I always used. I never liked these chemical sunscreens. I'm a clean brand, okay? So this is something that we have you got covered. And you love the tinted one, don't you?
Yeah, that's actually the one that I'm going to put on now. Gemma, I think that code RENEE20 will work for Spain as well, just to let you know. Okay, so we do have the one that he was first talking about, the dark defense one, dark spot sun defense one. All of our SPFs are physical, which is the most important thing, right? But we do have one that has, we have two that have tints to them. So I'm going to actually use the tinted one right now. And the great thing about it, you guys, it's not like makeup. So it's not going to give you it's not going to give you coverage, but what it does is it just gives you a nice little glow and it helps even out your skin tone. So I love this one. And I love
Beautiful.
I feel like I don't really need makeup after I put it on. So this is like my definite go-to in the summer, because also I feel like my pores don't get clogged with this one. It's super lightweight and it doesn't have that like white kind of cast that can happen.
Right. And I just, as we're talking, patients of mine come to mind. I had a patient who told me that what she hates most about her breakouts is that they're bumpy. And she puts makeup on, but you can still see the bumps underneath the makeup. That's the part of acne that we also are treating here, okay? Because that started with a blocked pore, bacteria got trapped, the bacteria grew more and more, the body attacks it so it gets red, and then it gets bumpy. By taking care of all steps of what acne is all about with these products, the flattening of the breakouts you're going to see very quickly. And then your makeup's going to work better. And then you're going to see improvement above and beyond that, because they'll start to go away. And then we're going to stop that blockage from happening in the first place. This is the true way. You got to treat it. And dermatologists like me know that. Okay. So these are the tools you have at home now.
Okay, so a couple questions too, and this is a misconception too that I've heard from so many patients and even, clients that we see. People think that if you have darker skin, you don't need SPF. Can you talk a little bit about? I mean, I've seen so many people that are like, I'm from Africa. I have really dark. I don't need sunscreen because I don't burn. Can you?
It's true, and here's the reason. Okay, first of all, look, everyone's aging. And maybe you're breaking out now, and that's your reason for watching. But lines and wrinkles, let me tell you, sun exposure, that's going to do you in. Okay. Also, you know what? Maybe it's true that more darker complected people have more protection naturally from skin cancer, but they are even more susceptible to uneven skin tones. They're even more susceptible to hyperpigmentation. So sun is going to make all dark spots darker. That's a golden rule. And so this is why you need to wear your sunscreen so that you don't let that happen. It's a big mistake. And I'm going to tell you one more thing. Birth control pills plus sun plus the tendency to get discoloration, triple whammy, okay? So you got to wear sunscreen if you're on birth control pills, please.
And Linda, I want to actually answer this question because she's asking if there are certain makeup lines we recommend that don't block pores. There are a couple makeup lines that I'll tell you about. I love makeup lines that are, like Dennis is saying, oil-free, fragrance-free, paraben-free. So those makeup lines that I'd recommend would be lines like Smashbox, that would be Hourglass, Tarte. These are all lines you can get at Sephora that are in the same standards as what we believe and they're all completely oil-free, fragrance-free, paraben-free.
Tell them about Glow Pad. They want to know about self-tanners.
Oh, okay. So
we got a product for you. You want a self-tanner and you have breakouts and you want to look glowing.
So we have Glow Pads. We have glow pads for the face and the body. And it's amazing because the face ones, you can customize your tan. So I did one yesterday, and so did you, Dennis. Didn't you do one?
I did. Okay.
So they give you just a slight little glow, and they help, they really make your skin tone look beautiful and even, but it's not, you don't really see, you can customize how tan you want to be by how many times you use it. And also the one for the body is like it's almost like a huge towel. It's a big one that can cover your entire body, and I'm obsessed with them, especially right now because, I feel like when you have a tan, you feel better and you always look a little better, but the sun is so bad for your skin. So this is a way to kind of get that glow without being out there. And
it's a beautiful product. And if you want it, and the whole trick to the formula there, my team and I had to crack the code. How do you get no streaks? How do you get a real natural color to your skin? And how do you make it so that it goes on even and you can make it look lighter or darker depending on how you want to use it? All that's doable with this product. It has exfoliators in it a little bit to help get rid of the dead skin. It works beautifully with the alpha beta peel. They're designed to work together. You can do your peel first and then apply your glow pad. okay, for the self-tanning effect. That combo is beautiful.
Okay, and people want to know if the glow pads are okay for acne-prone skin.
Yes, absolutely. Absolutely. People love having a little color to your skin. Right now, I'm finding with my patients texting me, people aren't really wearing makeup when they're forced to be inside so much, but a glow, more skincare that really makes your skin look better, that's the way to go. And that's the new makeup, right? That's my wife's slogan. Skincare is the new makeup. I agree with that.
Yep. Okay, so you guys, thank you so much for joining us today. We want to let you know we're going to be back at 5 p.m. EST, and we're going to be talking about the do's and don'ts of at-home skincare, so things you should be doing. And I just want to kind of talk about, today we really talked about the importance of LED to treat acne. We talked about steaming. We talked about alpha beta peels. And the most important thing for you guys to walk away with is knowing that every pimple starts with a blocked pore. So you want to make sure that you're really taking care of those pores before the breakouts happen, because the pimple you see today happened 2 weeks earlier, right? So it's really about treating your skin consistently. Again, the code one more time is 59acne20. Thank you all so much. Come back and join us at 5 o'clock tonight. And at 5 o'clock, just to let you know, I know Jennifer and a couple of you had questions about like at-home micro needling devices. We're going to be talking more about that kind of stuff at 5 p.m. tonight.
And a lot of people want to watch this again. We're going to upload this to our YouTube channel. If you want to see it, or you forget some stuff, or you have someone who didn't see it, it'll be there probably maybe Monday, I'd say. Okay.
Amazing. Thank you. Oh, Joyce, her daughter watched today with her for the first time and really liked it. Oh, hi, good. Joyce's daughter. Okay. Thank you guys all so much. And we will hopefully see you all at 5.